Hey class! Today we're going to continue on with Chapter 5, the skeletal system, and this is the first lesson in Part 2. So you did Part 1 test, and now for the second half we're going to kind of talk about the bones specifically in our axial and our appendicular skeleton, and we're going to end on joints. Today we're going to focus on the axial skeleton. The axial skeleton forms the longitudinal axis of the body. So longitudinal is up and down. This is going to be divided into three parts that we're going to talk about. The first we're going to talk about is our skull. Then we're going to talk about our vertebral column, which takes place in a lot of the thoracic, abdominal, pelvic areas of our body. And then we're going to talk about the bony thorax. These three, again, it's very important to know that these belong to our axial skeleton. So, for example, in this image right here, our axial skeleton is going to be what is highlighted in blue. Again, we see that skull right here. We see our thoracic cage, and then our vertebral column right here are all going to be part of our axial skeleton. This image here just shows the posterior view. It forms the longitudinal axis of our body. Today we're going to focus on the skull. There are two sets of bones that form the skull. The first is cranium bones, and these bones are going to enclose our brains. The second is our facial bones, and the function of facial bones is to hold eyes in an anterior or forward position. It also allows facial muscles to express feelings. If you're happy, if you're sad, if you're kind of meh. The other thing to note when we talk about the skull is that the bones of the skull are joined by something called sutures, and sutures are interlocking, immovable joints. So these joints are connected and they do not have the ability to move. They are locked in place. The other thing to note about the skull is that the only joint that is able to move in the skull is known as the mandible or jawbone. Again, it is attached, it's the only freely movable joint that you guys are able to move. And we see that every day when you're talking. La, 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 la. We're going to only specifically focus on cranial bones today, and tomorrow we'll go over facial bones. So there are 8 cranial bones that protect the brain, and all 8 of these bones are considered flat bones. Again, flat bones means that we have a layer of spongy bone that's kind of sandwiched in between 2 layers of compact bone. Those 8 cranial bones are your frontal bone, occipital bone, ethmoid bone, sphenoid bone, and then there are 2 parietal bones because they form a pair. So again, bones 5th and 6th are 2 parietal bones. And then bones 7 and 8 is also another pair of bones, and this is your temporal bones. So for the first 3, your frontal bone forms the forehead. Think about the front of the skull. Frontal bone, forehead. Not only does it form the forehead, but any of those bony projections under the eyebrows where muscles are going to attach in order for you guys to raise your eyebrows or furrow them. It also forms the superior part of each of your eye's orbit. When we look at the frontal bone in this picture, again, here is our frontal bone. We see that, again, the whole forehead, but also the upper part of your eye and kind of where your eyebrows are going to go. The next one is your paired parietal bones. This is located on both sides of your head. This is going to form the most superior. So remember, superior means the top, and lateral. So lateral means the side walls of your cranium. So if we look at our parietal bone here, it forms, again, the most top parts, but also the top lateral or top sides of your skull. Up here, your parietal bone is illustrated with the color green. You have one on your right side, and then you have another paired matching bone on the left side as well. And the last one is your temporal bone. This is going to lie inferior or below your parietal bones. So if we look back at our picture, our temporal bone is illustrated here in orange. So everything in orange is part of your temporal bone. I always try to remember this is like your temple is on the sides of your head. So your temporal bone is where your temple would be. Now, I do want to talk about the temporal bone because it actually has very important bone markings. So bone markings on your temporal bone. If we don't remember, a bone marking is essentially a projection or a fissure, so something that protrudes out, or it can be an indentation or a hole in the bone that tell you where muscles, tendons, and ligaments attach, but they also kind of show where blood vessels pass through or nerves can pass through. And there are very important bone markings on the temporal bone to know. The first one is your external acoustic meatus. This is a canal that leads to your eardrum or middle ear. It's the route that sound takes to enter in the ear and for you guys to process what's going on. Do you hear a loud noise? Is someone softly whispering? This is the bone marking that allows that route or travel. If we're looking at a picture, your external acoustic meatus is going to be right here where you would expect your ear to be, because again, that's where sound travels into. The second type is a styloid process, and your styloid process is a very sharp, needle-like projection. It's located inferior or below your external acoustic meatus, and this is where a lot of neck muscles attach to. So if I were to bring up this image, your styloid process is located kind of right here. Again, you see that needle-like point. It's right below your external acoustic. And the last one on this slide is the zygomatic process. This is a thin bridge of bone that joins with the cheekbones anteriorly. So zygomatic process is this entire length from here to here. It's that bridge, and it bridges your temporal bone up here with your cheekbone, or your zygomatic bone is what we'll learn to call that. The last one that we'll talk about is the mastoid process. This is a rough projection that is both posterior, so behind, and then inferior is below. So both behind and below the external acoustic meatus. It's really close to that styloid process, and this provides an attachment point for muscles of the neck to, again, attach to. There are a lot of other bone markings that allow for muscle attachment and passageway of blood vessels and nerves, but these are the big ones that I want you to know. If we look at our picture, our mastoid process is, again, right here. It's below the acoustic meatus and then behind it. It's kind of a below and behind. Over here, I just wanted to show that the orange part is your temporal bone, and these are all bone markings within the temporal bone. This is another viewpoint of the bone. I do not give you this picture to label at all. This is if you were to cut the skull in half, so remove the top half of the skull, and you're looking down at it from the top. It kind of shows what the temporal bone looks like if you were to look inside your skull without a brain there. This shows several other bone markings that you see within this bone that I don't expect you to know. One of the big ones that I don't expect you to know is your jugular foramen. This is where the vein that drains your brain exits through. Here is another view. This view of the human skull is inferior view, so that means if you were looking at it from the bottom. Again, the orange is still your temporal bone, but here is an example of what your mastoid process looks like if you were looking at the bottom of the skull. Again, this is your styloid process. If you're looking at the bottom of the skull, you can kind of still see that it is a point. Even your zygomatic process right here, we see more of that bridge that protrudes out. Again, here are some other markings that I don't expect you to know. I already pointed out the jugular, but carotid canal is also located in your temporal bone, and this is where your carotid artery takes blood to your brain. The next bone is your occipital bone. This is the most posterior, so this is behind, the most farthest part behind your skull. It forms the base of the skull as well and the back wall of the skull. In your occipital bone, there is a very large opening on the bottom, and we call this the foramen magnum. I will expect you to know this, and I will talk about it when we get to the talking about the vertebrae, because this is what actually allows your spinal cord to go up through your cranium or your skull to connect to the brain. It is a very, very large opening. And the other part is on either side of the foramen magnum, there are something called occipital condyles. And essentially, these are projections that allow your cranium or your skull to connect and sit on your spinal column or your vertebrae. This rests on the very first vertebrae of your backbone. Here is a lateral view. We have the occipital bone right here in the very back. If we look at it from underneath, this shows both the foramen magnum, that hole that is where your spinal cord is going to go through, and then our occipital condyles, which is our projection, and this sits on the first bones of our backbone. The next bone is your sphenoid bone. This spans the width of the skull and forms parts of the floor or the bottom of the cranial cavity, more towards the front of the brain though. Oftentimes we describe its shape as butterfly or bat shaped, and I'll bring up a picture where you can kind of see this description. Just like any other bone, there's a lot of bone markings that show where glands kind of sit, where nerves and blood vessels pass through. There are not any on this one that I specifically want you to know, but there are still bone markings. The other thing is that there are sphenoidal sinuses. So we'll talk about sinuses, and all these are just air cavities in certain bones that sinus cavities are in. Here is where it gets the name, where it's winged, butterflied, or bat-shaped, is our sphenoid bone. Again, it kind of comes out, forms a wing, comes over, and forms a wing. So a couple bone markings that some colleges might make you know is your foramen ovale here. This is, again, where a blood vessel will pass through. On the side of your head, the sphenoid bone kind of takes a little different view. Your sphenoid bone here is located in pink. It tends to take up a lot of the inner part of your cranium. And then again, if you were to take the top part of that cranium and cut it in half and look into the inside of it to form the front bottom part, this is your sphenoid bone, again in pink. There are a lot of bone markings. I don't expect you to know them. The first one is your silica turcica. This is actually where your pituitary gland, which is part of your endocrine system, sits on this. We also have an optic canal. The optic canal is where the optic nerve, which is the nerve that goes to your eye, passes through. And then we have the ethmoid bone. This is very irregularly shaped, and it lies anterior, so in front of the sphenoid bone. It forms the roof or the top part of your nasal cavity. Nasal cavity is your nose. And then it also forms the medial walls of your orbits. So medial means the inside wall of your eyes. There are bone markings in this bone as well to allow for nerve passageway, for muscles to attach. And then there are bone markings that form parts of your nasal cavity. And one of those bone markings that I am going to expect you to know is your superior and middle nasal conchae. Nasal should indicate that it is in the nose. Here, superior means it's going to be the top portions of your nose that kind of stick out, and the middle portion of your nose that sticks out. So here in orange, but like kind of a different color orange than your temporal, is your ethmoid. So just this little area that we're seeing here, again, it's in front of your sphenoid bone. It's a lot easier to kind of see your ethmoid bone from this image. Again, it's kind of that lighter orange. The ethmoid bone has several different bone markings, and here are two of them, the cribriform plate and the cristogali. But again, you are not expected to know those. What you are expected to know with your ethmoid bone is, again, the middle nasal concha, and I have it highlighted here. Again, these are bony projections within your nose. This projection is going to be brought up in the respiratory system. It's where a lot of air gets trapped in order to help warm it and moisten it before it goes down into your lungs. The last thing we're going to cover besides the cranial bones is something called sutures. Sutures connect all of your cranial bones together in your skull, and these are immovable joints. There are 4 major sutures that you need to know, and the first one is called a sagittal suture. This forms the midline where the 2 parietal bones meet. So it's not shown in that image, it's shown right here. So we have the one side of the parietal bone, we have the other side of the parietal bone, and they connect at, again, this sagittal suture right here down the middle. And if we remember what the word sagittal means, it means where you split your body into right and left halves. So hopefully this name makes sense for that. The second type is the coronal suture. This is going to form where your parietal bones meet your frontal bone. The way I remember that is coronal, like a crown. It forms that suture. So if we look here, your coronal suture is right here, forms kind of the crown of the head, where your frontal meets your parietal. It goes all the way around, like a headband. The second 2 names are a little bit harder to remember. We have the squamous or squamous sutures. This is where your temporal bone meets your parietal bone. And then you have your lambdoid suture, and this is where your occipital bone is going to attach to your parietal bones anteriorly. So if we look at our squamous suture, it is, again, squamous suture forms here between your temporal and your parietal. And then here you have your lambdoid suture. This is going to be more between your parietal and your occipital down below. Here is another view of the different sutures. This is a better view of your lambdoid suture, again, between your parietal and your occipital bone. And that's the end of today's lesson. If you have any questions, please make sure that you ask, and I hope you guys have a great day.